You mentioned healthcare. That's a prime interest of yours.
It sure is.
What do you see on Capitol Hill to give you optimism that there will be a change?
Well, let me give you the good news first. The good news is that there is increased discussion about the crisis. And let me just touch on some of the aspects of the crisis. And I think I don't have to tell the American people this, they know it better than we do. First thought, in our nation, over 35 million Americans have no health insurance whatsoever. That means people get ill, they have an accident, they go to the hospital, they're going to be paying off those bills for God knows how long. In addition to that, you have another 50 million Americans who have only partial insurance. So they end up in the hospital, they say, boy, I'm covered, but what ends up happening is they're going to have to pay thousands of dollars for their health care bills. And what that means is, by the way, among other things, is that studies indicate that about 25% of American people hesitate, delay going to the doctor or the hospital because they're afraid of the bill. So what happens if you're sick and you delay going to the doctor? Guess what? You get sicker. The bill is larger. You may end up dying. Senior citizens are in very serious trouble. They are spending, despite Medicare, 18% of their incomes on health insurance, on health care needs. In my own state of Vermont, Blue Cross Blue Shield just is in the process of raising what they call Medicomp, which covers non-Medicare related health care needs by 24%. That's going on all over the country. In terms of prescription drugs, cost of prescription drugs is going off the wall. I don't know how many viewers know that the same prescription drugs that are manufactured in this country are sold in Canada, are sold in Europe far, far cheaper than they are in the United States, because we don't have a national health care system which stands up to the drug companies. So we're getting ripped off in that respect. Now, in addition, we have an infant mortality rate in this country which is 22nd in the world, 22nd in the world. Now, we used to be 23rd, but East Germany merged with West Germany, so we've moved up to 22nd. That is a national disgrace. Life expectancy, we're 12th in the world. That means there are 11 other countries where the people live longer. Now, having said all of that, people may say, well, the reason that we have so many uninsured people, the reason that infant mortality is so high, we're just not spending enough money. But obviously, that is not the answer. The fact of the matter is we are spending far, far, far more than any country on earth. And to me, what we have got to do, and in fact, I don't know, Lou, if you could show this, this is a graph which indicates the amount of money we spent over here. Canadians spend the second amount, and that's 40% less, and then you go on down. So we are spending far more than any other country on earth, and yet we're getting very little out of it. Clearly, I think the solution must be a movement toward a single-payer, universal, comprehensive health care, similar to what exists in Canada. People say that the Canadian system has problems. It does. But if we understand they are spending 40% less per capita than we are, I think by level funding healthcare at the present level of $756 billion, we can eliminate virtually all of those problems and have the best healthcare system in the world, where every man, woman, and child has all of the healthcare that they need without any out-of-pocket expense. And what we have got to do is move toward a single-payer system, which essentially says to the 1,500 private insurance companies, thank you, you've had your day, we can no longer afford to keep you. As you may recall, there was a study that just came out last week by the Government Accounting Office, the GAO, which suggested that if we move toward a single-payer system, we would save some $67 billion by eliminating all of the billing practices. What's going on in this country, you go to a hospital, you're getting billed, and you have Blue Cross, and you have Connecticut General, and you have Travelers. It is enormously confusing for the hospitals, for the doctors, and everyone's spending all of their time and money billing us. In Canada, you have a single pay. You walk into the hospital, you don't pay anything. Maybe the telephone bill is what they charge you. So the direction must be single payer, eliminating the private insurance companies, and also with the single payer, you can have some real cost containment. So that's what I am working very hard on in Congress. Now, the good news is there is more discussion than ever about that in Congress. The bad news is that I really don't believe that the Congress will have the courage to ultimately stand up to the insurance companies and the drug companies and the AMA and the big money health industry people. They have a lot of power. They put a lot of money into PACs. And I don't think that Congress, as it's presently constituted, can stand up to it. My hope is that all over America, by the millions, senior citizens, workers, middle-class people, all people, begin to say, hey, this system is no longer working. We need national health care. And basically say, I'm not voting for any member of Congress who is not prepared to support a single-payer, comprehensive, universal national health care system.
Good.